name is Shelley Spiegel-Coleman. I'm the Executive Director of Californians Together, and we are thrilled that you are with us for our 6th Community of Practice on supporting immigrant and refugee students. Distance learning has accentuated the dire need for sensitive, supportive, and targeted services and attention for our immigrant and refugee students and their parents. Many of our parents are still working in the fields, stocking our shelves in markets, supporting essential workers in hospitals and service industries. Some young children are being supervised by older siblings, and when parents come home from work, getting on the internet when available to Seesaw, Dojo, Schoolology, and other apps, mostly with English assignments and instructions, is just not a realistic expectation. We are going to start today's session with a presentation by the California Immigrant Rights Center. Following the presentation, each of you will join a breakout room to reflect upon the information shared and how that relates to the services and districts learning you are offering to your immigrant and refugee students. So it's really my pleasure to be able to introduce to you Cynthia Buisa and Orville Thomas, the Executive Director and the Director of Government Affairs from the California Immigrant Policy Center. They are an immigrant rights organization that advocates for policies that upholds the humanity of immigrants and refugees while advancing racial, social, and economic justice. We're so thankful that they could be with us. So Cynthia and Orville, take it away.
Thank you, Shelley and Californians Together for inviting us. It's a privilege to be able to join this community, and hopefully it's the beginning of a partnership with you. As you pointed out, Shelley, we are the California Immigrant Policy Center, and I'm just going to very briefly lay out the big picture around what immigrants and refugee populations are going through during this moment in this pandemic. And then I'm going to hand it over to Orville to speak a little bit more about what is at stake in California for these populations, as well as in the state budget, because frankly, I know that many probably of your audiences are also curious about where we are now with the state reeling from an economic recession, a much more modest budget that's coming out of the legislature and the governor's office, and what is the impact of these new issues on these populations that we all serve. So I just want to state from the beginning, on the first slide, you can see that this is kind of the big picture landscape on what has happened, what is the situation within vulnerable populations and the impact of this pandemic on them. We already know that there's certain inequalities and disparities have been heightened by the pandemic. And really, at the end of the day, early data has suggested that COVID-19 has disproportionately affected already vulnerable groups like Latino populations and African American populations. That hasn't changed. We are very interested in knowing a little bit more from your community. What are some of your concerns in terms of this particular population, where many immigrants and refugees as well belong? For the next slide, if there is a breakdown of proportions of cases and deaths by race and ethnicity among ages 18 to 34, and you can see there's these really stark numbers among Latino and African American populations, as well as white populations, obviously. So these numbers are alarming, because I know that among your member organizations and the communities that are part of CIPC stakeholders, these are also the populations that we've been trying to really protect, whose access to basic services and this, frankly, the safety net we have been trying to protect for a long time. The next slide it looks at among these populations, who are they, right? And what we know now is that many essential workers belong to these populations. Their ability to work from home is impacted by the crisis. Many of them live in dense cities and overcrowded apartments. There is a basic distrust of the medical system, frankly, because of very aggressive anti-immigrant and anti-refugee policies that have existed for a long time. These are also communities that lack access to financial resources and financial opportunities, including access to affordable housing and healthcare, and already populations that are really suffering from major issues around health equity, right? So they are often exposed to health risks, experiencing increased risk of serious illnesses, and really inability to afford basic health care. So I am going to move into, in the interest of time, because I would like Orville to be able to really dig a little deeper on the budget. Let's move to the slides around what does all this data mean for students, right? Well, let's jump one slide ahead. And really for the data that I've shared with you and its effect on these populations of color that are being negatively impacted by the crisis, there's one basic thing, right? If a student's parent is an essential worker, aside from higher exposure to risks, the student may or may not have their parent to provide additional guidance to complete tasks or homework. We actually have community members telling us that sometimes just because they're very scared to lose their jobs or their employment or health insurance, some of these workers are not telling other employers that they're sick. If a parent decides to stay home, that means loss of income, which can impact many other things like food security, can lead to access to housing, not to mention the high levels of stress and anxiety that both children and parents are already going through. And the loss of all of these supports exacerbates other losses, including access to computers and digital technology. You know, much have been said about how the situation we're going through right now has highlighted who actually can study and work from home and who cannot, that many of our students, many of the children that we assume can just easily pivot from studying in the classroom and studying at home are actually not able to do that. And there is already data to prove that. Food security issues, you know, what are some of the vulnerabilities that these families are experiencing in terms of that? I don't know if you have been tracking what's been going on in the Central Valley, for example, where many farm worker families are really experiencing, you know, in an irony of ironies, experiencing hunger because there's not enough food. So I hope that this helps kind of paint a big picture about the stark conditions that many of the student populations and their families that you serve are facing right now. The situation is both urgent and critical, and it is important that the audiences in this webinar understand that many of the cross-cutting issues really have a disparate impact on low-income students, both immigrants and refugees. Please remember that there are already many other anti-immigrant and anti-refugees policies in place before this pandemic, right? Between the lack of ability to seek asylum to the public charge issue, which is creating a major chilling effect among immigrant and frankly, even refugee populations, because there's just this blanket fear that's been created around that. I hope that it helps illustrate how much we really need to think about what are the different layers of vulnerabilities these populations are experiencing, so that whether in partnership with each other, with us or other agencies, we can break down the issues that may have a devastating impact on these student populations. So with that said, we'd be happy to take some questions later, but I am going to hand it over to Orville for a little bit of a deep dive into what is in the governor's budget and what folks can expect, at least in terms of education funding, if that information were already available. So thank you for again inviting us, and I will hand it over to you, Orville.
Yeah, thank you, Cynthia, so much for setting the stage for my part. You know, as Cynthia pointed out, there is some things in the governor's budget that really does maintain historic funding for our immigrant and refugee communities, especially as it pertains to the education system and helping them become more involved in their community. So when I want to talk about one of the programs that was able to maintain its funding proposal during the governor's May budget revision was funding for refugee and unaccompanied minors and providing school grants. In 2017, California provided about $10 million in funding over the span of 3 years for establishing the Cal New program. For this governor's May budget revision proposal, they maintained their January budget ask of $15 million of one-time funding to be spread out over 3 years to assist school districts in improving the English language proficiency of newly arriving students, while also supporting their academic and personal well-being. You know, this is something that we know, and especially in the education field, you guys all know, does such a huge service for our community members that are coming and that are facing adversity in several different aspects of their life. And it just allows them to have some kind of funding cycle for schools and school districts to provide the resources to integrate them into what is already a challenging environment. As most of you know, the social determinants of health play such a huge role in the ability to learn. That's why CIPC was deeply disturbed by the governor's May budget proposal and the revisions, especially the cuts to some programs that we know are vital to our community, especially our community members, to establish an environment that's healthy and that allows for families to grow in education and through the learning process. The two ones that we are very focused on for CIPC is making sure that we can get to health for all, so providing healthcare access to all Californians regardless of immigration status, and expanding the California Earned Income Tax Credit to those workers that file their taxes and pay the IRS with an individual taxpayer identification number instead of a social security number. On the Health for All front, we were successful over the last couple of years in expanding Medi-Cal coverage to Health for All kids, so 18 and under. Last January, or this January, we started seeing the expansion of Medi-Cal to those that qualify, ages 19 to 26. And this January, we had a budget proposal from the governor that outlined expanding Medi-Cal access to undocumented community members ages 65 and up. And unfortunately, the COVID-19 pandemic has really decimated the state's economic outlook. I'm sure the education community is really concerned with what these upcoming cuts are, but the cuts to health and economic justice are really going to affect the community members before they step foot on a campus or a school. So when we were talking about what happens with undocumented elders not having access to preventative care, these are also our community members that are so vital in taking care of the children of the community while their parents are at work or while their parents are in the immigration process. And we cannot understate the importance that these members of the community have in making sure that the next generation of immigrants and community members grow up in healthy households. So not having them included in Medi-Cal access, especially in light of a pandemic, is really something that is distressing to immigrant communities and organizations, and a goal that we are pushing the administration on to find funding so that they can make sure that everyone who is most at risk can receive care after this emergency proclamation ends and before any second wave of a pandemic or a flu season begins. On the economic justice front, CIPC and our other advocates have been fighting for the expansion of the Earned Income Tax Credit, which is a vital source of funding for low-wage workers in California, to be expanded to those immigrants that file without a Social Security number. We've seen that this is a great resource for bringing people out of poverty that are very close to the poverty line, and also making sure that families are given the necessary resources to take care of their young ones, to provide things that are needed for educational attainment, like access to a doctor, dentist, or even just getting school materials and getting things as necessary as clothes and food onto a family's table and into their closets. So we are asking the administration to consider these two investments, and we have seen great support from all the caucuses, especially the Latino caucus and the Asian Pacific Islander caucus, to make sure that as California's legislature thinks through the post-COVID-19 pandemic recovery, that we don't forget about our immigrant communities and make sure that those low-wage workers that are essential to our recovery are given the programs and safety net benefits that are essential to living. Thank you, and I think we have room for questions. Either post all our talks, so I'll remain and Cynthia remain.
Cynthia and Orville will be taking questions a little later. So if you have questions, make sure you keep them and generate them in the next part of our communities of practice. So it's really my pleasure to be able to introduce to you representatives from the Delano Union Elementary School District, who will talk to us about some of their promising practices and some of the systems that they've created to really reach out to all of their students. So initially, the person who will be talking to us will be Elva Hennessy. Elva Hennessy, she's the Director of English Language Development. And then she'll be introducing Tina Tyler Smith, who sees the Director of Student Support Services, Foster Youth, and the McKinley Vento Liaison. And then lastly, so important, Linda Inosa, who is the registered nurse and the Director of their health services. So Elva, do you want to start us off?
Good afternoon. Thank you, Californians Together, for inviting us this afternoon. And thank you for all the work you do. It's so important, the community connections that you're making. Just a little bit of background about our district. We are a K-8 district. We have about 12 schools. We have 6,900 students. Approximately half are English learners, and many of them are immigrants. And like you, we struggled in those weeks in March to decide how we were going to do distance learning, and that continues to evolve. But one of our proudest initiatives is our systems of support for students, especially our most vulnerable students. We had a communication line for them as soon as they are registered, or as soon as we know that students are in crisis, we have that communication line going. We have a marriage and family therapist. We have director of nurses that does more than her trade might be her profession might be a nurse by trade, but she does much more than that. And then we have one more thing that we are doing, and it's our superintendent has really inspired us to believe that all of us matter. And our new motto nowadays is all hands on deck. Everyone has a purpose, and we all are trying to locate students. We go out to locate students, from the administrative assistant in the front office to the instructional assistants to our after-school tutors. Everyone has a purpose and is committed to helping locate and help our students get online so that learning will occur. So that's one of the two things we're proudest of. So with that little introduction, I'll hand it over to Tina.
All right, thank you so much. Thank you for inviting us. Again, my name is Tina Tyler Smith, and I'm the Director of Student Support Services. And I'm also the Foster Youth and McKinney Vento Liaison, our homeless population. And I have been given the wonderful privilege of developing something for our district that we had somewhat in place, but it wasn't as in place as we wanted it to be. But we have a mental health support team that includes several people that were already in our district, but now we are just working as just a well-oiled machine, which includes 5 school psychologists, 2 in addition to our 5 school psychologists, there are 2 intern psychologists, 4 social workers. We have 1 marriage and family therapist. On that mental health support team, it includes myself, the Director of Student Support Services, along with Linda Hinojosa, and our Director of Special Ed, which is Wendy Terrazas. We also have partnered with outside agencies to help support our families, such as Child Guidance and other mental health agencies that are working directly with us in order to provide the support we already know that our families and our students will need. Elva mentioned our district hotline, and that is working phenomenally well for us. As anyone can call into that hotline, and it's being monitored by lots of different people, from enrollment, if there's somebody that needs services, maybe their child is struggling and not logging on, or if they feel like there's some other issues, there is a team member assigned to every one of our school sites, which she mentioned are 12. But if there is a crisis, the crisis team, it would include a school psychologist, a school social worker, and our marriage and family therapist to work directly with that school site, that family, to just make sure all needs are being met and issues are being addressed for that student or the family. Anyone can refer anyone to our team for support. And those team members, they have targeted groups that they have already been working with, their normal caseload, but they are particularly focused in on our foster youth, our homeless youth, and any of those students that are at promise, those groups that we mentioned before. Half of our population is English language learners, and so we know that there are challenges that come along with our students that are in those subgroups, and we are really intentional about making sure that we're focusing in on them. I do have an example of a student who is a McKinney-Vento student who was historically homeless, and we're so excited because even with the COVID-19 and all the changes that are happening, this student is graduating from our middle school on to high school, but it was because of people like this. They've been really intentional about making sure all the needs have been met for this student. What we do know in working with this team, and we meet once or twice a week, no less than once a week, to just really see how we can support our families. We are fully aware that domestic violence is on the rise, child abuse is on the rise, depression, anxiety, trauma, all of those things. But our hope is that we can help mitigate any of those things that are happening, particularly our kids that might have some suicide ideation. So we're talking about all of those things and how we can jump ahead of it and be responsive to our families and our students. We also have, with that team, what we've done is we've put together a district resource page where parents can go, when we are working directly with those families and those students, we can refer them to those resources that are attached to our webpage. It includes things like daily schedules, social stories that have to do with COVID-19 and how to help kids understand it, journals, easy infographics, social distancing, infographics, family activities, self-care tips, and even our newsletter, which we'll share in a slide in just a little bit. Also, we have staff supports because we do understand that our staff, they are stressed and they are dealing with so much more. And so we have provided resources for them to be able to reach out to our teams. Some of our team members are working directly with the school sites and providing Zoom meetings where teachers can just come in, and not as a requirement, but because they want to, and talk about certain things on how we can help with their frustrations, share some self-care activities for them, do a needs assessment to see where they are and what their needed supports are. And to try to keep it light and fun, because we know they need a little bit of that as well. They're calling it coffee and donuts, and just kind of giving them an opportunity to take a look at some activities and some self-care ideas to just kind of help them continue with the efforts. So I'm gonna have you take a look at a couple of the slides. Our mental health team, with this being Mental Health Awareness Month, it was perfect for us to push out a campaign. And what we decided to do is to do this during our food distribution. And we wanted to make sure that we started addressing the stigma of mental health and letting students and parents know that it's okay not to be okay. One of the slides that we had was that putting the message, we made fence signs and things for us to put on every school site that it's okay not to be okay. We provided some activities and made it an opportunity for kids to dress up, and we gave them a lot of ideas. We wanted to get the staff involved, the teachers, and placing a lot of the pictures on our website to just make it fun for students, really to engage them in that conversation about mental health. The other thing, and I think there's another slide, that has to do with calendar activities. Go down to May Mindfulness. That's the one I need. Now, this wasn't one that we created, but it is one that we thought was fantastic for our youth, and then we had it translated. So this was also something that we gave during our food distribution, and we have big posters of it on the fences so that parents had activities that they can do every day that helped with social emotional learning, building a sense of community within their family, just helping them work together as a family. So this was something that we put out. The other thing, I think we can go to the next one. We're almost done here, and I'm going to turn it over to the next presenter. Let's take a look at, I think it's is it the mental health flyer? And then we'll come back to the news. Oh, that'll be fine. And so what we have also done is we've put together a newsletter to go out to families. And this has also been pushed out on our Facebook pages at every single one of our school sites. We are making sure it goes within the Class Dojo platform for teachers. And we are doing what we can to push these tips out to our teachers and to our family members. This was put together by our school psychologist for the mental health team. And the parents are finding it very, very useful, and it's both translated in English and Spanish. So those are some of the things that we're doing with our families. And we, like I said, a plethora of information on our webpage that we are referring them and walking them to. So those are just some of the things that we're doing to help to support our families, our staff, and our students during this time. And the next portion, I'm going to turn it over to Linda Hinojosa, who is my partner in crime, and we work very, very closely together. So it's an honor to present with her today. Thank you for having me.
Hi, good afternoon, everybody. It's a pleasure to present. I have been a school nurse for 20 years and a registered nurse for about 27 years now, and I absolutely love my job. I think it is very important that we are connecting with those people that we serve. And in Delano, we're kind of the heart of, a lot of people immigrating into the country, whether it be sometimes from the Philippines, from Mexico. Most recently, we've received a lot of immigrants coming from South America, a lot of people on political asylum. So I have the lens of looking at kids' education through the lens of health, and how can I help them maximize, their learning? What can I do as a school nurse? So the first thing that I wanted to go ahead and share is that I actually am satellited at Delano Community Connection Center. That is our family resource center. It was formed with a Healthy Start grant many years ago in 1995. Healthy Start was, available for many, organizations. Of course, a lot of them have gone away because once a source of funding has gone, then Healthy Start grants or Healthy Family Resource Centers kind of went to the wayside. Our district has been very smart about maintaining our Family Resource Center, and I am actually in kind and not funded by anybody, but it is the perfect place to be. We are, as a community safety net, not only with the city of Delano, but also within our own school community as a safety net to address our most vulnerable. And I think it was already kind of stated earlier, our immigrants and newcomers are already have lots of concerns. They're already on the fringes, and the pandemic has really exacerbated everything. All the problems for people of color are, just really kind of blown up. The good thing about the Family Resource Centers, we are actually a nonprofit. So we accept monetary donations. And I cannot overemphasize the power of strong connections within the community and the partners that are in our community. With that being said, I know with all of this, COVID relief and people getting extra, money, because it's a pandemic, a lot of the people that we serve and that we're trying to help do not qualify for any of that programming. There's no program, the COVID relief, no, it was stated earlier about income taxes. They don't qualify for anything. So one of our biggest focus is to go ahead and serve this undocumented population. Again, we have received a big influx of people that are on political asylum. Unfortunately, we have people coming to our center for clothes, for food, whatever it should be. And we have been able to help them because of our nonprofit status and being able to receive money from the community. Just this last week, I received a donation of $10,000, and that money is really focused on helping our, most vulnerable population, which again is that lens of the undocumented population and those that are not here or are afraid of public charge or afraid of, various things. So, and I really believe that engaging with our community partners, we have been able to move the needle, for social determinants of health. Although wages and income are not health outcomes, but they're closely linked with health because they provide access to health-related resources such as healthy food and a healthy environment to live in, and of course, health care. One of my big priorities is that children are accessing healthcare services. We are very lucky to be in the state of California where kids under the age of 26 and below are eligible to receive Medi-Cal without any questions asked. I have 2 family advocates in my center that sign families up for Covered California. So it's really been a big push to get kids able to get their wellness checks, to have their immunizations up to date. So this has been really successful for us. We have also have a school-based vision clinic, which I'm very, very proud of, and I'll talk a little bit more about that. Another focus that we have is with our mental health. I know Tina shared quite a bit of what we're doing in the area of mental health. We do have a lot of partner agencies that we work for to connect families and especially our adult population. The parents of these children are often afraid, and a lot of times there's some kind of organic mental health condition where they need treatment, so we're able to help mental health on the adult side or the parent side. We do also have a food pantry that is very well stocked. If anybody needs any food, they could come to our center and pick up a food basket. We also, for at least 3 to 5 days, and we'll help them set them up with other organizations as well. But we always have food, different types of food, depending on where the family's living. Sometimes they might be homeless, so we might take that into consideration, give them a gift card. We kind of just go to where the family is at and what their needs are. For COVID relief, again, a lot of our families did not receive COVID relief. However, we have recently, in addition to the $10,000 that we've received, there was another pot of money through the CARES Act that gave us $13,000 that also was received last week. We are able to purchase some cleaning supplies. I know for myself, when this whole pandemic broke out and we were reporting to work as an essential worker, we know what the situation was with toilet paper, cleaning supplies, paper towels, any of those things. Our families are essential workers out in the field working. They don't have time to be waiting in line at Walmart or hoping that the shelves are restocked. So we are able to help, families with those types of supplies because we need to keep them healthy as well. We do also have a partnership with Southern California Edison and Southern California Gas. We can pay utility bills up to $200 per family on each one of those bills because, with living in the valley, things are really hot or they're running their gas. And the program is set up so that we don't have to ask for documentation. We're able to help families out in that respect. So really a lot of success with that. I think by far, one of my greatest or proudest, achievements is as a school nurse. We can all, understand, and for those of us that wear glasses, if you can't see, It doesn't matter if that little body is in that seat or not. If that student cannot see the whiteboard, if they cannot read, they are unable to access the curriculum that is being delivered. We have, again, 7,000 students through the state mandates. We do hearing and vision screenings on pretty much half of the population in kindergarten, 2nd grade, 5th grade, and 8th grade. So half of our population was screened every year for hearing and vision. I'd send out a referral letter and said, oh, your son, failed their vision screening or needs to go see an optometrist. We only have 2 providers in our community. Unfortunately, those 2 providers would only see 5 Medi-Cal appointments per month. That meant that the parent would have to be waiting at that office at 7 a.m. to try to get their son or daughter in for an appointment. Impossible. And I was referring thousands of kids. Maybe 5% of those were able to get in, get an eye exam and be seen and get a pair of glasses. I started working with a nonprofit, the Advanced Center for Eye Care, about 5 years ago, and shipping some kids down for a big mega clinic to get eyeglasses. That nonprofit, turned into a relationship with a local for-profit provider within the community of Bakersfield. There was a small window of opportunity for us to apply for a grant and build a vision center. Perfect. I went to my superintendent and I said, this is what we need to do. And she was very amenable to that. She went ahead and allocated LCAP funding, and the LCAP funding is over a couple of years so that we are able to see all kids. We've built out a vision center. It is complete with 2 exam rooms. You can see in our photo here, we also have a dedicated van. The van goes to, appointments are set up for the children. The van goes to the school site, picks up the child, takes them to the vision center. They have their eyes checked. They're there at the vision center for maybe an hour or 2. They get back in the van and they go back to the school site and continue with their curriculum. A couple weeks later, they will receive their eyeglasses, and the school nurses will help to dispense those eyeglasses. And we have seen, just amazing, results with that. We have seen kids that have increase in grade levels, a better comprehension. They're more engaged in learning, decrease in concerns with discipline, and this is all completely free to all of our kids. There's a little bit of LCAP funding that is reserved for those kids that do not qualify for any kind of program, and there's no funding to pay for that exam or glasses. We're able to meet that need. So I am very pleased that we have really seen a remarkable success. We are now targeting those early readers and looking at those that are, 1st grade to 3rd grade. If they're not advancing in their grade level, they're not moving up, we can go ahead and refer them to the Vision Center. Of course, the big focus is always going to be our immigrant children that are new to the area and their family is afraid to apply for benefits, or perhaps they're not eligible for benefits, or they're migrants and they're moving from county to county. So we are able to get them in, get them seen, and get them a pair of glasses. I've noticed over the years that a lot of our families that come from central Mexico or even further south, Central America, there's a lot of astigmatism that is prevalent, and that needs to be corrected. Without that correction, children really are not able to see. So this is something that is definitely would be scalable for any district to do. And it's, LCAP funding, I couldn't, be more pleased that our district really, put the money into this and, built our vision clinic, and it has been amazing.
Thank you so much from Delano Union Elementary School District. There were just so many important pieces of information as well as services. And I think you'll see how they have adjusted systems. They have made some systems work for the children who absolutely need it. So again, thank you so much. We're real pleased now to have a presentation from Didi Camarena, who is the coordinator for multicultural humanities education at the Santa Clara County Office of Education. And so Didi, I'm going to ask you to go ahead and start your presentation. Thank you for being with us.
Thank you. Hello, everybody. Today I'm here to present to you some work that we've done at the county office. So as you see, we've titled it Beyond DACA. And the reason we ended up doing that is there was much interest from speaking with so many different entities, school districts and county, as far as what have our immigrant and refugee students, what have they had for resources, and what resources have the educators had? And what came out of that initial conversation was there isn't a lot out there, and many people do not know about the different issues, the challenges that our immigrant and refugee students have. So as you see here, we have a team that was assembled. There's 2 of us from the county office, myself and Olivia Sampian. And then we've also partnered with the Santa Clara County Office of Immigration, in addition to Foothill de Anza Colleges, Campbell Union High School District, and the Undocu Spartan Center at San Jose State University. So we have everybody in the room in order to pull the resources that we have, because we realized, hey, I think the public needs to know about this, and we have so many requests from educators for more resources. We decided to pull all of us together and pull some resources together and some information together to share it with them. So we ended up having a 2-day workshop. And as you see, this is our goals for our first day of our workshop. Systems and structures, building a safe place, local and recent immigration updates, in addition to navigating academia with DACA, and then we had some resources to share. So this presentation was primarily done from a representative from the Office of Immigrant Relations. So she went into explanation and more depth into immigration policies, our California demographics, in addition to trauma-informed care, executive orders, the threatening of DACA these days, temporary protected status, in addition to travel ban, ICE in California, public charge, immigrant families, resources, funding for districts, importance of the census, and any legal ramifications. So just that in and of itself was a lot to take in and much to explain. But considering we had over 130 representatives or 130 participants, we realized that this was much needed information to get out to the public. And therefore, that's what we comprised it for our first day presentation. And then we also had a focus question for that day, and specifically focusing on the systems and structures. We found that many school districts and entities did not have a system in place in order to support their immigrant and refugee students. So after receiving the information from the presentation, we chimed more into this as far as, so what system and structures do you have in place for them? And what are you lacking, so that we could help them meet their needs in a future presentation and reflect upon the information that they were given. So as we see here for our goal for our day 2, so we took the information and the feedback from day 1 and we built our presentation for day 2. So we really focused on what we call the Undocu Allies Network, which is at San Jose State University. So the representative from there presented what they are currently doing at San Jose State. Additionally, we found that we needed to tackle trauma that the immigrant students face. So for example, as we were speaking of what are our needs in order to meet with our immigrant and refugee students, tapping into just how are you doing? Tapping into those social, emotional needs that our students have to make sure that they feel safe, and what resources are they in need of. And then we also built onto how to build community and a space for this self-care that many of these students and their families need. As you can see for your focus questions, we continued with structures and systems to support our undocumented students, how you can be an Undocu ally with the support of San Jose State, and the other resources that we wanted, what other resources did they need to bring back to their communities. So at the end of each session for each day, we gave them plenty of resources that were available in a Google folder that we made for them. These are just 3 of the resources that were shared. We had an organization, which many of you might be familiar with, titled Immigrants Rising. They're part of our network as well. And so the one in the middle is specifically something that they, the one on the right is specifically something that they gave to us. And they also reminded us of the binder of resources that they do have that are available. So we were taking all of these, all the resources that we thought that they would like. In addition, we took feedback from the group in order to supply different resources that they may need as well. And so at this point, and that we finished the 2 different workshops, we really want to continue the work moving into next year. Now that we know that there is a huge need for resources for this population of students, we want to continue with that work and develop a compilation of resources specifically meeting the needs and the feedback that our participants gave. So that's what we're looking into going into next year. We are going to continue to partner with these people that you saw originally on the second slide, San Jose State, Office of Immigrants and Relations, and some school districts as well. We want to pull, again, their expertise and look to see what we can develop for all of next year coming in. So that was everything in a nutshell what we are doing here at the county office. We do know that it is something that we're very passionate about, especially considering that many of our partnering school districts and organizations do need more resources and want more of a network in order to do this work moving forward. So we look to continue this moving into the following school year. There's so many things that are unsure of at this time, so it may look a little bit different, but the team that we have comprised together to facilitate the previous workshops is something that we're going to hold dear to us and continue working with them in order to get our educators the best resources and all the support that they need moving forward to support their immigrant and refugee students. Thank you.
Thank you so much, Dee Dee, Tina, Linda, and Elva. How about a round of applause or a thumbs up for all of our presenters? They did such a great job. Now's the time for us to ask you some questions, and we've had quite a few questions. I'll be asking them to you. Orville, we have one question for you. You mentioned the $15 million that remained in the May revise for helping immigrant students with with progress for English language proficiency. Can you say a little bit more about that funding and when it might be available and under what format and what agency is going to be sponsoring that funding?
Thank you. That's a great question. So the program is a continuation of a 2017 program started called Cal New. For those that have had an opportunity to work with that kind of agent or program agency and those grants, the actual appropriation still is contingent upon the June 15th budget. So there is some advocacy needed on our end as immigrant supporters and making sure that it meets the final criteria and is included in the legislature's budget bill. So I will make sure to work with Manuel and make all the advocacy opportunities available for that specific program, and also make sure that if it does get past June 15th, that all the information on how to apply for it or how your school districts can get it will be available shortly thereafter.
Orville, that would be great if you could send us the information to Manuel, and we'll make it in terms of advocacy for that $15 million. I'm sure there's a lot of people who were interested in that, and it would be great for those of you who are on the Zoom to think about having your district formally send in a letter supporting that appropriations, because that would make a tremendous difference in terms of our elected officials understanding from the district's perspective the importance of that funding. So thank you so much for that information. Just to any of you who are on the call, this came up a lot in the questions, and that was, how do we support the language needs of families that are the less common languages and maybe aren't traditionally represented in the district translation services? So anybody from the panel who wants to address that? So I can tell you, and then those from the panel, if you jump in afterwards, in my breakout room, there was a terrific response to that. You met, if you've been on some of our previous Zooms, Charlene Freed, who's from Baldwin Park School District, had a student from Nepal. And basically, the language of her children was Spanish, but she had no resources for translating what was going on, what the resources were for that family, what the assignments are, so on and so forth. She went to a university, looked up for speakers of that language, got somebody to come into her Zoom and talk to that family in their language. And I thought that that was such a good idea. And so she said, don't forget to reach out to your communities. Think about your churches, your universities, your, if elementary, think about maybe some of your high school students who are bilingual in those languages, and try to bring them into one of your Zooms with your parents and have them speak to them in their home language. Charlene said that that made a tremendous amount of difference. So it may not be employees, but it may be people from the community that you can pull in for that support.
That's a great idea. I think that's a great idea. We use some of our community members for students that speak Tagalog. But yes, and 84% of our language learners speak Spanish, but we do have on occasion students who don't speak Spanish. It's a different language. So that's a great idea.
And then just for Delano, can you tell us, how do you know about how many of your English learners do you think are currently participating in the distance learning? How many, or what percentage, we might say, of English learners?
So we have, for 3rd through 8th grade, we know we have about 84% are on. We have about 20% of our students that aren't. We have not distinguished between immigrant or not, but we know that 20% of, we need to do the legwork for 20% of our students. Our vice principals, our principals are out knocking on doors and keeping their distance, but they are looking. There was one kid that said to one of the principals, they're not gonna find me. And sure enough, we drove to McFarland and we found him. So it's just the legwork that we are doing to get all of our students that are registered connected to learning. So we are, it's hard work.
Is there anybody else who wants to talk about the percentages of their students who are participating? And how you've been able to reach out to those who initially were not participating?
Yes, this is Dee Dee, and I would just like to share something that one of our teachers are doing within our county. She has had a relationship with a student for a very long time, and because of that, she feels very comfortable with delivering the resources to the student. And it's one of those where she just hops on the phone, they have a conversation, and what the students need, she makes sure that that student gets the paper and pencil version of it, because that's the only thing that has worked. With that said, the student was absent and not communicating for about 7 weeks. So the one piece of information that I asked her to relate to me was, what is the one thing that everyone can do to make sure that they're in touch with all of their students? And she said, don't give up. Just keep calling them and keep trying them and keep doing that. Eventually they're gonna realize you aren't giving up on them and they will appreciate it. And this one particular student that this teacher was telling me about actually told that to her. Thank you so much for not giving up on me, because this student did screw up, but teacher was still there. And it's due to that phenomenal relationship that she has with the student that she's able to listen and get the student what the student needs, and the student trusts her, and it's a safe environment for her. So I think that just goes a long way of reaching our students and their families.
And I think you're seeing some wonderful ideas responding to this in the chat room. I love the one that Kimberly shared with reaching out to the local radio station. In Oxnard, I know there's a radio station called Radio Indígena, and I think that radio station reaches out to the Mixteco population. And so they're using them to reach out to the families and to their parents. And so thinking about the media, the local media possibilities in your community is really a wonderful, wonderful idea. Some of the answers to our questions are not just verbally here, but if you look at the chat room, you'll see a lot of wonderful resources. And she put the phone number in for Radio Indígena. That's great. So what about, one of the questions was, several of our families are not tech literate or literate in any language. How do we support them? Sharon, you were in my breakout room. I don't know if you want to unmute yourself and talk about what you've done with the short videos that you have on the website. Well, Sharon was sharing with us that on their website, and I think we've heard that from in some of our other Zoom gatherings, they have very short video clips in different languages showing the parents exactly how to get onto Zoom, exactly how to get to Seesaw, exactly how to look at maybe Remind so that they can see the notices that go to them, or to Dojo, and that they're very short, they're in the parents' language, they don't involve literacy, And there is some visuals there in terms of the platforms and what parents need to do. So something to consider. And if Sharon's not on, maybe we'll contact her and get a link for you to their district website. I see from Elizabeth Freilich, they do some of the same things. And Elizabeth, is it on Fresno Unified's website? Are those PowerPoints with voiceovers on the website? And Norma, go ahead, Norma, and then maybe Elizabeth after Norma.
Okay, hi. So this is Norma Morales from Milpitas Unified School District. We do have a large number of EL students. The students that most are at risk are Latino students. So what we're doing with our families, actually we had a small team of 2 liaisons, one of our parents, which is the tech guy, and our EL coordinator. Every Tuesday, we're actually calling our parents, our families, our moms and their dads, and we are teaching them how to navigate the system in their language, in Spanish. We're doing a presentation. It's 40 minutes, although sometimes it ends up 2 hours because parents have a lot of questions, or you can actually see how basic information they don't know as turning on the computer, where the app is. And we're teaching them, you know, like how to use Parent Square or Aries, the systems that we usually use, and even how to translate a message that the teachers are sending to them, how to use Google Translate and how to use other tools that they can help themselves to be able to, instead of waiting for us to call or them, you know, the parents saying, I don't know how to help them out. I don't even know what they're talking about. We're teaching them those tools, and parents are being very, very grateful about it. We're steadily increasing our numbers. It's hard because obviously most of our parents, they have to work and they have numerous kids at home. But it is a lot of work, but it's definitely been successful. Also, we are targeting our parents that they kind of have contact with other families so they can teach them and help them out for us. Thank you.
Thank you so much, Norma. Elizabeth, are you
Yes, I'm here.
So tell us about what you put on the Fresno Unified School District website.
Right. Well, we haven't put a lot of these things on the website because we're trying to work through schools and our admin at schools. So a lot of those resources go out to schools specifically, or with specific parent groups when we meet with them.
And so what about these PowerPoints and the voiceovers for them? What are they?
They're going, like, for instance, we have what we call English learners. We have site reps at every site. They're the EL admin, and they're the people we like the information to go out through the site to make sure that parents are getting their questions answered. So that's how we're dealing with it now. We have some things on our website. We have a parent area where parents can access information and different resources for their kids and things. And we certainly could put some of this on there. We just haven't gotten there yet. We're working on training all of our district teachers and admin right now on immersive reader. We're working with our curriculum department because they're the ones that really seem to know quite a bit more about some of the virtual tools than we do. We're all learning really quickly. And so they've been helping us develop things, and we're working on doing an immersive reader training for parents right now. So.
Okay.
Yeah, they will give them access to a lot of the work their kids are doing, and, you know, give them the ability to translate what they see and that kind of thing.
Elizabeth, if there are any of those PowerPoints that the local districts are doing that you think would be helpful, and you can send them to us, we could send them out. Links also. That would be very helpful.
I also posted a question in the chat about ELAC and DLAC. I'd love to hear what people are doing in terms of virtual access with that.
We could not have paid you for a better entree to our next announcements.
But you are.
So I think we'll move on. And Ed, if you want to move us forward. Thank you so much for the discussions. So look, next week, Elizabeth and everybody else, we are having our upcoming, we have two more for sure. We're going to take a little break, and there may be more coming up, but we have 2 more for sure, communities of practice. And next week, we are going to look at parent engagement with a focus on DLACs and ELACs. And we're going to be having 2 districts talk about their DLACs and one school site talk about their ELACs and how they have been conducting them during distance learning and what they've learned, and some very, very incredible resources that they have developed. So if you yourself and maybe others who are working with your ELACs and DLACs want to join us, again, you see the registration area, and we'd love to have you be a part of that. And then on June 9th, we really want to kind of pull a lot of this together, and we're going to talk about how do we center English learners in the pivot to reopening schools. What is it that we've learned now? What is it that we know needs attention for us to think about when school reopens? And so we hope that you'll all be joining us for our next 2 sessions that are coming up. And with that, we really do want to give a special thank you to all of our presenters. And we often haven't thanked our facilitators. Some of you probably are getting to know our facilitators. There's a group of 30 to 40 people who have consistently come back every week on a volunteer basis to facilitate our breakout rooms. They themselves are really incredible resources in the area of educating English learners. We could not do that without them. So we appreciate the district, the county office, and CIPC for the terrific work that they're doing for our communities. And while we're closing out, Ed, I don't know if you want to go to Menti again. We hope that you will write in the chat room a wish that you might have for supporting distance learning for immigrant and refugee students, either by the state, your district, your school, your colleagues, or we Californians together. So here are our wishes, right? Equity, support, access. The words that are the biggest are the ones that get the most repeated notice and writings. So this is great.
Amazing.